I started running a fever, a temperature, probably once a month. And I thought nothing about it, didn't pay any attention to it. Started having some changes in my stomach and bowel movements. And the fevers went from once a month to once every other week. And I would just take Tylenol PM and keep going and pressing on. Then started having blood in my stool. And still, you know how we are, I kept going. And the fevers went from once every other week to once a week. And then it went from every other day. And then it became, it was a rarity when I wasn't running 100+ degree fever, day in and day out. Finally, went to the doctor, went to the VA hospital and did some tests and checked my stool, had blood in my stool. And so they scheduled a colonoscopy for me. I thought, oh, this will be no big deal, just something minor. They'll give me antibiotics and life will go on, it'll be good. When I came out of the fog of the anesthesia, the nurse was there with a copy, pictures of my colonoscopy. And first thing out of her mouth was, normally we tell you to go down and schedule for a procedure if it needs to be removed or some kind of treatment. Well, she said, I went ahead and scheduled your surgery. So then, for the first time, it kind of hit me, the seriousness of this. You start thinking then about your own mortality. And you know, the first thing you think is, oh my gosh, especially colon cancer in men, there's a high rate of death from colon cancer in males, especially in African-American males. And here I was, 44 years old, 45 years old, I'm thinking, wow, is this it? Well, my nature is not to stay settled for long, and I thought, well, I'll do whatever I have to do to stay on this earth. I kind of attacked the diagnosis of cancer and the treatment of it and the battle with it in the same way that you're kind of taught in the military. You identify your objective, what your task, what your mission is, and then you focus on the job to be done. And then you take into consideration everything that could go right and what could go wrong. And you try to plan for that. And that's what the military has taught me overall in life, to have a main plan, but don't be afraid to deviate from that plan, and to be able to change and adapt. 3 years without any cancer, 2 more years to go before I'm officially declared completely cancer-free, and looking forward to that. I stress to everyone, especially men of a certain age, I'm 47 now, go see your doctor. Go find out. Know what's going on in your body. We've lost too many to this disease, and you owe it to yourself, you owe it to your family members to know what's going on with your health.